Acquired valvular disease of the heart. The function of normal heart valves is to maintain the forward flow of blood from the atria to the ventricles and from the ventricles to the great vessels. Valvular damage may interfere with valvular function by stenosis or by impaired closure that allows backward leakage of blood, valvular insufficiency, regurgitation, or incompetence. Mitral stenosis. Mitral stenosis is the progressive thickening and contracture of valve casts with narrowing of the orifice and progressive obstruction to blood flow. Acute rheumatic valvulitis has glued the mitral valves flaps commissures together, thus shortening the chordae tendineae so that the flap edges are pulled down, greatly narrowing the mitral orifice. The left atrium has difficulty in emptying itself through the narrow orifice into the left ventricle. Therefore, it dilates and hypertrophies. Pulmonary circulation becomes congested. As a result of the abnormally high pulmonary arterial pressure that must be maintained, the right ventricle is subjected to a pressure overload and may eventually fail. Mitral insufficiency. Mitral insufficiency, regurgitation, is incomplete closure of the mitral valve during systole, allowing blood to flow back into the left atrium. Left arterial pressure increases. Left ventricular hypertrophy may develop due to inefficient emptying. May be due to valve distortion or shortening or damage to chordae tendineae or papillary muscles caused by mitral valve prolapse, chronic rheumatic heart disease, post-infarction mitral regurgitation, infective endocarditis, and penetrating and non-penetrating trauma. Clinical manifestations: fatigue, weakness, dyspnea, cough, orthopnea, nocturnal dyspnea, murmur. Mitral stenosis increased first heart sound, opening snap, and low-pitched rumbling diastolic murmur heard at the apex. Mitral insufficiency, soft first heart sound and a blowing pan-systolic murmur heard at the apex and transmitted to the axilla, characteristic of mild regurgitation due to papillary muscle dysfunction of mitral prolapse. Dysarrhythmias, palpitations, hemoptysis from pulmonary hypertension, and hoarseness from compression of left recurrent laryngeal nerve in mitral stenosis. Diagnostic evaluation: ECG may show dysarrhythmias, echocardiography may show abnormalities of valve structure and function and chamber size and thickness. Chest X-ray may show cardiomegaly and pulmonary vascular congestion. Cardiac catheterization and angiography to confirm diagnosis and determine severity. Medical therapy: antibiotic prophylaxis for endocarditis before invasive procedures indicated in most cases. Treatment of heart failure: diuretics, sodium restriction, vasodilators, cardiac glycosides, and so forth as indicated. Surgical intervention for mitral stenosis: closed mitral valvotomy, introduction of a dilator through the mitral valve to split its commissures. Open mitral valvotomy, direct incision of the commissures. Mitral valve replacement. Balloon valvuloplasty. A balloon tipped catheter is percutaneously inserted, threaded to the affected valve and positioned across the narrowing orifice. The balloon is inflated, deflated, causing a cracking of the calcified commissures and enlargement of the valve orifice. For mitral insufficiency, mitral valve replacement or annuloplasty, retailoring of the valve ring. Complications: congestive heart failure, possible right-sided heart failure, and dysarrhythmias.